Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Azoospermia. Azoospermia is sperm concent. If there are no sperms in the semen, then it is azoospermia. No sperms in the semen, then it is azoospermia. Azoospermia can be of three types. It can be pre-testicular, where hypothalamus and pituitary defect is present. It can be testicular, where the defect is in testis, or it can be post-testicular, where there is blockade in the sperm pathway. First, testicular. If the in We will see the differences between pre-testicular azoospermia, testicular azoospermia, and post-testicular azoospermia. In pre-testicular azoospermia, the problem is in hypothalamus and pituitary. In testicular azoospermia, the problem is in testis. In post-testicular azoospermia, the problem is in sperm pathway. In pre-testicular azoospermia, luteinizing hormone decreases, follicle stimulating hormone decreases, and testosterone also decreases. In testicular azoospermia, testosterone decreases, whereas luteinizing hormone and follicle stimulating hormone increases because of because there is testis defect is in testis. So here in testicular pathway, defect is in testis, so testosterone decreases. Because of decreased testosterone, the pituitary starts to produce increased LH and increased FSH. Because normally if there is more testosterone inhibits luteinizing hormone and follicle stimulating hormone through negative feedback mechanism. Because of decreased testosterone, negative feedback mechanism is absent, so there is increased luteinizing hormone and increased follicle stimulating hormone. Spermatogenesis may or may not be present. Post testicular. In post testicular, there is block is present in the sperm pathway. In this, all the hormones are normal. Luteinizing hormone, follicle stimulating hormone is normal. It shows the best prognosis. Obstructive.
thank you and thank you for watching.